brought to you by the Dow Health.
This is Delve, a podcast that endeavours to enlighten and support you in understanding and transforming your own health.
Hello, my name is Elizabeth Cullen and my co-hosts are Clarice Berry and Molly Burton. And together we will be drawing on the Dow Health's signature and unique integrative approach to traditional Chinese medicine.
So take a seat at our table, grab a tea, and let's dive deep into the enduring legacy and evolution of medical practices over time.
This episode is proudly brought to you by Vitally, our trusted platform for connecting patients with practitioner-recommended supplements and lifestyle products. As a practitioner, Vitaly's platform is seamless to recommend everything from high-quality, practitioner-only supplements to non-toxic skincare, eco-friendly cleaning products, and wholesome, healthy snacks, all in the one place. For patients, Vitally supports your health journey in the most convenient way possible by bringing high-quality options right to your doorstep, curated by your practitioner, just for you. Thank you so much to Vitally for making this episode of Delve possible. Hello and welcome back to the second episode of Delve podcast. Let's jump straight into it today as we're going to be talking about points of relief managing endometriosis. So let's get around the table. What is one way you prepare for your bleed each month, Clarice?
So, I am very prone to having a lot of premenstrual tension. I get a lot of physical symptoms like bloating. I'll sometimes get pain, a lot of breast tenderness, but also the irritability and my emotional swings can be quite significant some months. So I really focus on trying to bring in my magnesium more frequently, which really helps with those body symptoms and pain. Also calming with that magnesium glycinate. It's fantastic. And I also have to make more of a conscious effort to reduce inflammation in my diet. I'm a big sweet lover. I love my sugar.
Yeah.
It's something I'm trying to work on. So I reduce my chocolate, reduce alcohol if I am drinking, which I don't drink a whole lot, but I'm more conscious of it post-ovulation. I'll make sure I'm not drinking because I find it reduces a lot of my symptoms leading into my period too.
And Molly, how about you? How do you prepare for your bleed each month?
Yeah, what I usually do to prepare for my bleed is allow myself more rest if needed. So I think the first half of the cycle, which we will talk about in future episodes, use a lot of energy, working very hard to ovulate, produce that egg. And then what happens when we move into that luteal phase, the body's working really hard to prepare for the bleed. So it's utilizing a lot of energy. That's why we sometimes feel more hungry than you might have the previous week. And I think it's important that we listen to our bodies. That's what I do. Okay. If I need to sleep in a little bit longer, I will, making sure that I go to bed just that little bit earlier so I can have adequate rest. It really does set me up for a good bleed.
Absolutely.
Yeah.
Absolutely. I guess mine comes from yours as well, Molly, in the way of so the months can go so quickly, and I find if I'm tracking on my app, so I use Clue app.
Yeah.
I find that's a really user-friendly app.
Yeah.
I've used that for almost 10 years now. I will start to schedule what life's looking like around ovulation, and I'm really mindful about that time around ovulation. You know, when you feel like you can conquer the world, you've got so much energy, I'm feeling so motivated. Let's catch up with girlfriends or let's catch up with family friends. And instead I'm hang on. If you're planning something right now, that's literally going to be just before your bleed.
Yeah.
So I make sure I'm okay, hang on, maybe schedule that in a month's time around the next ovulation and schedule downtime for that next 2 weeks leading into the bleed.
Love it.
I've found that helps so much because if I find an open window in my calendar, I'm let's catch up, let's do something social. Whereas if I've scheduled that downtime, makes a big difference.
Really important.
Yeah. So let's take it back with endometriosis and let's get into our dynasty section.
Yeah.
Okay. So when we talk about dynasty section with endometriosis, it was really interesting in the poll. We asked our community when was the term endometriosis first used in medicine, and 84% of our community actually said 1960. Interestingly, 16% said 1800. So I think that's fair enough.
Yeah.
Because when you think about it, endometriosis, there's still so much that's unknown. But let's take it back all the way to 2,000 years ago in Chinese medicine.
Here we are. We did tell you that we've been talking about these things for thousands of years.
Yeah. So really, really interesting.
Yeah.
In Chinese medicine gynecology texts, there is the first mentions of endometriosis. Symptoms are explained rather than the term endometriosis of pelvic pain, painful periods, and infertility. And not only in China was this mentioned, but also in the ancient texts from Rome and Greece in 5th and 4th centuries
Amazing.
BC.
Wow.
Super interesting.
Yeah.
So the term endometriosis not used, but we're already talking about this thousands of years back, and women are suffering from these symptoms. So interestingly, now I'm going to mess this word up. Molly? Hippocrates?
Hippocrates?
Hippocrates. See?
Hippocrates.
There we
go. They actually viewed the following 4 factors as highly predictive of gynecology disease. So number 1, menstrual dysfunction is a cause of disease. Pregnancy is a possible cure. Lol, we'll talk about that. Pain and infertility as potential outcomes if the woman is left untreated, which, I think we can agree with number 1, number 3, and then number 2. We're moving away from that.
We are.
Please.
Yes.
Yeah. Thank God. So let's get back to Hippocrates. Treatment
work.
options. Thank you. Treatment options available at this time. So poor women. It included ingestible concoctions, fumigates, or suppositories that contain substances such as urine of men.
Ooh.
Because men fix everything. Lol.
That's
Or bulls. Tar waste, chaste tree, what we now know as Vitex, which is interesting. Pomegranates, I'm not going to be able to pronounce this next word, cantharides or castor oil. So there was things that were being used. Some of these were leading women to infertility, and a lot of these weren't being very effective. There's photos from Egypt, which we can share on our socials, of even women's health in general, women who were experiencing uterine prolapse, and they're actually being hung upside down.
By their feet?
By their feet, so that whatever prolapse they had, whether it be the uterus or the bladder, is actually being
moved
back
thinking
with
that gravity can...
Like, it makes sense of, and if they were really suffering with symptoms and they didn't have any other option or treatment. But I think what this highlights is that for thousands of years, women have been struggling. And we're still now in 2025 talking about managing endometriosis, and we don't know
what the cure is.
So they were doing their best then. And today we're going to do
Even
our
better.
best and talk about what the best options are. But let's keep diving into where we're then at in the last few hundred years with endometriosis. So in 1860, a doctor called Karl Rokitansky had the intuition that endometrial glands and stomas can be present in the ovaries. So now they're able to look at surgery, and they're going, okay,
What's going on in there?
what's going on? What's going on? In 1899, Russell W. first identified the chocolate cyst and was able to recognise that this was linked with endometriosis. And then in 1960s, laparoscopies, so a less invasive way to diagnose endometriosis, was introduced.
Wow. So
We've made progress.
we have,
There's still a very, very long way to go. So where are we now? So according to Endometriosis Australia, which is doing so much incredible work to increase the awareness of endometriosis, but also education and funding research, they say that endometriosis affects almost 1 million Australians.
It's a lot.
It's a lot.
And I think a lot of that percentage too, I think there's higher numbers
100%,
than that. I think it's a lot higher.
Absolutely. Also, when you think about 6.5 years on average to diagnose, is what's that going to be in the other 6.5 years, with how many women are suffering from endometriosis? And then also, I'd be interested in those stats. Is that only the women who have had endometriosis diagnosed by laparoscopy?
I believe so.
Yeah.
There'd be many women that would be walking around the community now potentially, or I would guarantee with
Yes.
endometriosis,
Yeah.
that firstly probably don't understand the symptoms of endometriosis, what that could look like. And then unfortunately haven't had the access to healthcare to be able to investigate that further, which is really tough, especially in 2025.
Absolutely. So from there, 1 in 10 women are struggling with those symptoms, but as we've said, it would be many more, and there isn't a current cure. So we know the way forward is management rather than cure at this stage. So that's what we're going to dive into today. Interestingly, our followers are completely across what endometriosis is.
Yeah.
I don't think we need to spend time really talking about what endometriosis is. I think we really need to spend this time on how we can manage it most effectively for patients.
Yeah.
We know it's a common disease where tissue is similar to the lining of the womb, which grows outside in other parts of the body. And interestingly, our community is so across this with saying, you know, can you have endometriosis and not experience pain? 100% of our community said yes.
Yeah.
So that's incredible. I think the awareness around endometriosis has grown so much more and women are looking for these symptoms. I think also women aren't willing to tolerate these symptoms as much as they once were.
Yeah.
Definitely. I think it's also important to note too that not everybody with endo experiences pain either. And this is what we see a lot coming into clinic with a lot of those patients that may have some unexplained like infertility or they're struggling to conceive. There are a lot of systemic other presentations that we can see in them, but not everybody with endo experiences pain as well.
And on that, Clarice, for those patients who you suspect to have endometriosis but don't have symptoms, when do you usually find that comes up, that they start to do some investigation?
Usually it's when they have been trying for a little while now and they haven't had a positive pregnancy test, or they have had early pregnancies but have eventuated in loss, unfortunately. And further investigation is usually ordered at that point. And it's not always laparoscopy is the first point of call, but it starts a cascade of different investigations from that point.
Yeah, and
Absolutely.
I think that's important to highlight that endometriosis is a whole body inflammatory disease, unfortunately. So that can explain why some women may not experience pain, but it is disrupting other vital processes in the body, which can impact fertility. And, you know, it was only this week I was discussing with a patient and she had gone through a laparoscopy and had been diagnosed with endometriosis and she had no symptoms to allude to that. But hopefully that could explain potentially why conception wasn't occurring. So I think it's important that we raise that discussion and we think about how can we manage this, because unfortunately we don't have a cure, but I think that is why Chinese medicine is so beautiful at this.
Absolutely.
Yeah.
Absolutely. And again, it's been treating these symptoms for thousands of years.
Thousands.
In addition to that, I guess when we talk about Endometriosis Australia, when I was prepping for this episode, I thought it was really interesting. Even on their website now, it says a diagnosis is not essential, depending on a few factors. So clinical symptoms and then wishes for pregnancy in the immediate future.
Yeah.
So I think across the board in Chinese medicine, complementary medicine, but also in Western medicine, like at the conference we were at last year and Endo conference and the PB conference the year before, everyone across the board is recognising, is a laparoscopy the best way forward for a diagnosis? Do we really need to reach that diagnosis, or can we be focusing on that management
and supporting the quality of
and
life?
supporting the quality of life? Because unfortunately, a laparoscopy also isn't the best option for some patients and they can experience the same symptoms afterwards.
We don't want to have to be put through a surgery in order to get a diagnosis. I think it's important that we support the quality of life. We support the symptoms may arise for that individual. And if they can get by day to day with the tools that we're going to discuss today, that's more important than sending them through a surgery or multiple surgeries as we hear in clinical, clinical practice. And then how that also affects the body too. So
absolutely.
I think that's great in terms of Endometriosis Australia. I think that is paving the way forward.
Yeah. And I think it's, I was going to say, building up confidence in patients. A lot of patients come in, they're like, I'm having so much pain. I think I've got endo. I need to get a diagnosis. You don't need a diagnosis. And unfortunately, the nature of endo is that it's highly, it regrows.
Aggressive.
It's aggressive because it's fed by the hormonal environment of the body. And that's why a lot of management strategies are hormonal that are given by a lot of gynos and fertility specialists. But yeah, it doesn't need to be diagnosed through laparoscopy, and a lot of things can be done outside of that we can help to manage those symptoms. And if we can prolong your first laparoscopy, it's going to lead to better outcomes too. Because if we can manage your quality of life through acupuncture and seeing your women's health, pelvic floor physio, getting you on herbs or supplements or what you feel comfortable with, and if that is comfortability using the pill, for example, or the Mirena, that's also fine. It has to suit where you're at in your life.
And cost.
Yeah. Which
accessibility side of things, which we'll go into as well.
Definitely.
Because we don't speak about that.
No.
Either we don't talk about the cost that it is for, or that it takes for each endometriosis sufferer. I'm going to use the word sufferer.
Yeah, definitely.
That the cost each year for them. And I think over a lifetime it was, I remember saying this at the conference, I can't remember, I think it was over 30,000.
Yeah.
It was massive.
It's like incredible how much this costs, and that isn't a conversation that's being had, as well as the days that are missed from work and university and school as well. So let's talk about our treatment options at the moment. And just to finish with that conversation around the laparoscopy side of things is, yes, have it as part of your tool belt or in your tool belt for when you are open to conceiving as well. And obviously you'll talk to your gynae about this and surgeon. But that's a time when if you can push that lap out, it makes a huge difference. And that's not spoken about either.
No.
Definitely. And also knowing that people with endo can conceive and have beautiful pregnancies.
Definitely.
Absolutely.
And the stage doesn't matter, as we've learned. So if you have stage 2 or stage 4, it doesn't
necessarily
mean that it can impact your fertility.
It's not all doom and gloom, and it really just comes down to decreasing the amount of inflammation in your body, managing your pain so you're feeling like your quality of life is great. And you don't know if you can't conceive until you give it a go.
Yeah, absolutely. Yeah, absolutely. So we know there's 3 types of management and treatment at the moment. So we've gone over medical treatment from a contraception perspective.
Yeah.
Interestingly, again, our community is across this. So we asked, can you have acupuncture alongside contraception to manage endometriosis? And that was 100% yes. I remember at the conference we did last year, our In Conversation talk in May, managing endometriosis, and that was a question that came up about, can you use contraception alongside acupuncture? And most people were across it but weren't sure with Chinese herbs, which just to make sure that people know is that you can.
You can, definitely. Definitely.
So we've got our medical treatment, surgical treatment we've spoken about, and then we've got our complementary treatment, which we'll dive into more today. There is no best treatment for endometriosis. And as we know with endometriosis, every individual has their own set of symptoms, which can also change over time. It's a very, very complex condition.
Very complex. And it can range from having, women presenting to clinic with like a lot of digestive complaints, and that's their core symptom that they're experiencing with endo, and they might not have any period pain. And digestive things are huge with endo because it is systemic, and mental health associated with endo is huge.
And the fatigue is a massive symptom that is presented in clinic, and I think that alongside everything else the body is going through. Also, just to highlight, it's not just when you're bleeding either. Some women are not bleeding because they might have the Mirena IUD in, or they might be on the contraceptive pill where their gynecologist has asked them to skip their bleeds, but they're still experiencing pain throughout the cycle. So that's another misconception that I think is important to debunk, that you don't necessarily, it's not all linked in with the bleed itself, the period each month.
Absolutely. And some patients do have their biggest flare-up around ovulation.
Yeah.
It's not their period that is the time where they're really suffering. It's around ovulation, which also gets very confusing when trying to diagnose endometriosis for these patients.
Which is why we have to look at it differently for each individual. Yes, in a room full of women, we've got 10 different women all diagnosed with endometriosis, or they may suspect endometriosis there. But each treatment option and tools are going to be different.
Definitely.
And
Absolutely.
what works for one woman might not work for the other. And I think that's also important to highlight. And also, as an individual who may be listening, if something's not working for you, you know, investigate, go down a different path, find a really good team to support you.
Yeah.
And when you do that, you need to be consistent, I think, for at least 3 months.
Definitely.
Of trying a new treatment.
Yeah.
And also the endometriosis community now, whether it be on Endometriosis Australia groups or Facebook, that's a really good place to be asking for recommendations as well, and making sure you are seeing a gynecologist where you feel really heard and supported.
Yeah. And that wants to do treatment that you feel comfortable with. But I will just say as a quick tip too, for those patients who might have the Mirena IUD or the Kylena, which is another IUD just with lower dose progestin in it, track your pain flare-ups because we often see in clinic it does line up in a biphasic pattern where we'll see it happening 2 weeks in, which is probably around your time of ovulation, and then another pain flare-up 2 weeks after, which is usually when your bleed occurs. And you might not be getting any spotting or bleeding, but if we can track your pain flare-ups, that means we can implement different treatment strategies preceding that pain flare-up to help manage your symptoms as well.
Let's just dive into how Chinese medicine supports managing endometriosis. I think the most beautiful thing about Chinese medicine and supporting patients with endometriosis is tailoring the treatment to the symptoms that they have. So endometriosis is the umbrella term, but each individual has a different set of symptoms that are forever changing for some patients. And we treat the pattern, so the underlying pattern of what's causing that blood stagnation or that pelvic pain or whatever those symptoms may be of endometriosis. So one patient with endometriosis might have a completely different pattern of diagnosis to another.
Definitely. Could you explain just for our listeners what like a pattern diagnosis is?
Yes, sure. So if we were to circle back to episode 1 where you were talking about that Zhang Fu theory, Clarice, and then Molly, you were talking about that qi and blood and yin and yang, we're looking at all of those components and where is there a weakness in the body, where is there potentially an excess or where there may not be enough. So say, for example, not enough blood or qi in the body, or there might be too much, or it may be stuck. So we're looking at all of these different components when diagnosing, and we'll ask specific questions to find out that diagnosis. So in Chinese medicine, we say where there is stagnation, there is pain. So we're asking particular questions in that first 2-hour consult that are leading us, we're being detectives, that are leading us to find what your pattern of diagnosis is. And when we find that pattern of diagnosis, we then treat accordingly.
Yeah.
We utilize
Does that answer the question?
Yeah, perfectly.
Okay.
Perfect.
utilizing tools like our tongue and our pulse, as well as those investigative questions to come up with that diagnosis as a whole, and then developing a treatment plan for that individual.
Yeah, absolutely.
So in terms of endometriosis, and when Liz was talking about stagnation, I think it's important to unpack what that word is. So the way I like to describe it in clinical practice, essentially there's traffic on the highway. So we're looking out at the city today, there's a bit of traffic, there's a bit of commotion. The commotion can cause inflammation, and it's the beauty of Chinese medicine that encourages the traffic to move and allow the blood and the qi to move freely through the body. Because when we do that, that's going to ease the symptoms and the pain that can cause.
Absolutely.
Come along with that.
And then where's the traffic on the highway?
Traffic in the highway can be in all different parts of the body, but mainly we're talking about the reproductive area, pelvic area. It's important to note that some women that don't have uterus still have pain in the reproductive area. So in terms of acupuncture and traditional Chinese medicine, what we're doing is encouraging blood flow freely throughout the whole body, but also through the reproductive organs. We talk really specifically about channel systems. So we've got 12 different meridians on the body, and depending on that individual diagnosis, we will treat a number of different channels to help that traffic move freely throughout the body.
And when you think about endometrial tissue, so if you've had a lap and you've seen the photos of what endometrial tissue looks like, it literally is blood stagnation. It's stuck blood.
It literally
dark.
is. Yes,
and the tongue is dark.
Everything's stuck. Yeah.
And often
stuck.
women, not all the time, but some women might experience darker periods too, which is indicating that there's more stagnation in that blood, because we want your period generally in Chinese medicine to be a nice, healthy, fresh cherry colour. Not too bright, not too dark, but somewhere in between. And yeah, sometimes looking at the colour of your period can give us an indication if there is more stagnation in your body too.
And what about clotting?
And clotting too, because clotting is just another manifestation of that stagnant of blood that's come together as well. And you might find too, whilst we're talking about pain and endo, that adenomyosis is another big topic that we're not going into too much today, but it often accompanies endo as well. And some of the big key symptoms of adenomyosis is having really heavy clotty periods too. There's a lot of inflammation, but we treat it almost very similar to endo, because it is just a stagnation of qi and blood in the pelvis and through different meridian systems. And I was just going to say too, going back to that traffic on the highway, it doesn't have to just be in the pelvis. And this is where our channel theory comes in. Some women experience pain radiating down their groin, down the back of their legs, through their back. And they're all different channels in Chinese medicine, which gives us an indication of what areas we want to needle on the body too.
So I think our community definitely has a thorough understanding that acupuncture can manage symptoms of endometriosis, but I thought we'd dive into the mechanisms of why.
Yeah.
Definitely.
Yeah.
So acupuncture is a form of sensory stimulation that induces changes in the central nervous system. These changes trigger physiological and psychological processes on multiple pathways, reducing the driving factors of endometriosis. So one of our favourite pain relief points, so large intestine 4, this point, when you actually insert the acupuncture needle, you activate the nerve receptors around the area. Now, those nerve receptors then activate the neuron pathway all the way up to the brain to be able to stimulate those hormones and that physiological effect from a chemical perspective to release those chemicals.
Endorphins?
Well, yes.
Sorry, pain relief. Yeah.
Yes. Yeah. Exactly. Yeah. To provide an analgesic effect, they help to release those chemical effects of hormones.
Yeah.
Yeah.
And then also through physically inserting needles locally to where the areas of inflammation and pain are, you're stimulating direct blood flow to where that needle end finishes.
Absolutely.
Which then gives the body another signal that, there's something going on here. It sends in a response and actually cleans out a lot of the inflammation markers that are there causing a lot of pain too.
Yeah,
which is why we use local points on the abdomen, for example, but then we will use distal points, like you mentioned, large intestine 4 on the hand.
Or spleen 6. Spleen 6 is then going to activate that uterine reflex as well, which is just incredible.
Yeah. I was going to say spleen 6 is somewhere on the leg. I'm not going to lift my leg up. It's on the lower leg.
And
a favourite.
Contraindicated in pregnancy.
Yes. Yeah.
So let's go into those physiological and psychological processes. So number 1, pain relief. Okay, so acupuncture provides pain relief from symptoms associated with endometriosis, such as all of the symptoms that drive systemic inflammation, and then also pelvic pain is a big one. There was a study that the Dow was involved in with Mike Armour in 2018, and that study actually looked at manual acupuncture versus usual care alone. So usual care was no acupuncture compared to acupuncture treatment twice a week, and that was for 8 weeks. And the sample size was 30 females in between the age of 18 to 45 years old. And interestingly, this study showed a decrease in overall pain by 20% and 48% decrease in pelvic pain.
It's amazing.
How amazing is that?
It's great.
Incredible. So acupuncture has that analgesic effect, but not only is it great for pain relief, it also supports endocrine function. So we know that endometriosis has an element of affecting the immune system. So if we can help to regulate the immune system to support the body to be able to almost like, I don't want to use the word fight back. Fight back to fight back against endo as well.
Yeah, definitely.
Interestingly, research also shows, it's preliminary, that acupuncture promotes the inhibition of ectopic endometrial growth, and it's suggested to suppress serum estradiol levels. Now, from there, it also regulates the hypothalamic ovarian axis. So when we talk about that fertility component as well, we're helping to support ovulation. So for patients, say, for example, who have been on contraception to manage the symptoms of endometriosis. This is where acupuncture can come in to support the body to almost turn back on, to be able to regulate that HPO axis or open the bowel movement, like what we say in Chinese medicine, to support the body to come into that optimal state of fertility as well, to conceive.
And then utilizing acupuncture through that preconception phase to support symptoms that may arise, e.g. pain, fatigue, mental health, but to encourage ovulation once again until we receive that positive pregnancy test. So acupuncture can come in there. If there's any fears around coming off contraception leading into that preconception phase, we recommend starting before you cease the pill, for example, so we can begin to work and support that smooth flow of qi and blood, decrease inflammation, then you come and transition off the pill, and we can utilize those tools throughout each month-to-month cycle before we achieve a positive pregnancy test.
And how long, Molly, would you recommend for a patient to come in to support themselves to come off contraception?
So ideally anywhere from 3 months plus would be our golden rule. But
a year if possible.
I know, but of course we meet our patients at any point of their journey. So whether, you know, they're hoping to come off the pill next month, we'll do our best and ensure that we're having that frequency of treatment, because I think that's important to highlight, that acupuncture has a physiological response.
Absolutely.
So therefore there's a dose.
Absolutely.
So in order to achieve an accurate or an adequate therapeutic dose, we need at least 4 consecutive treatments of acupuncture before we can start to see any change. And we're working with a hormonal system when we want to turn on the HPO axis once again after being on the pill. It can take up to 3 months
to a year.
A year. So I think the sooner the better. But of course, if it's not within those parameters, of course, we'll help you.
Meet you anywhere on your journey.
Definitely. On the journey side of things. And we can also use Chinese herbal medicine there too. And moxa is someone with endometriosis's best friend.
Best friend.
So moxibustion is an epinogenic herb that we burn on top of the acupuncture needles, and we'll use that locally but also distally, so locally on the lower abdomen, and it supports this blood flow to increase, supporting the circulation in the lower abdomen to reduce pain.
And it feels amazing.
I love your analogy.
So good.
What's my analogy? Oh, yes.
Your highlighter.
Yeah.
What is moxa?
What is moxa? So usually when patients are asking me what this is, I'm like, look, I'm putting in all the acupuncture points, which is I'm giving the body some instructions, and then the moxa's the highlights. And I'm telling the body, hey, I really want you to focus in on this area or what I'm putting this point on, whether it's building qi and blood, moving stagnation, which is just a really nice way to look at it.
Love that.
Yeah.
Yeah, that's great. So let's talk about accessibility with acupuncture as well. So as Molly was saying, we like to see patients ideally 3 months prior to coming off, say, for example, contraception, sorry. But I think when we talk about committing to a type of treatment, if you're trying something different with endometriosis, then if you can commit to the 3 months, the reason being is we don't see those hormonal changes until 3 months because of egg quality side of things is 90 days. So I think just thinking about it from that side of things of how you can talk to your Chinese medicine practitioner about what is practical for you of how many times that you can come. So if a practitioner was like, look, the research shows that you need to come twice a week, but that's not doable for you from a cost perspective, but also time perspective, then you can have a chat and say, look, this is what I can do, because I know as a practitioner, I want to see you for a longer period of time rather than a short stint at the start. That's why we design those treatment plans for a patient that's coming in to manage endometriosis of weekly treatment for 4 weeks, and then we push it out. When we push it out, we like to tailor that around the time where you have those flare-ups, right? So if we know that you flare more so around ovulation, I like to see you just before ovulation and then before the menses. And then we'll start to push it out to maintenance. The way at the Dow Health that we've acknowledged that accessibility is an issue with Chinese medicine and acupuncture, as well as other allied healthcare, such as women's health physio, is we've opened the Period Pain and Pins clinic last July. It's the first of its kind, and it's a clinic to support women to be able to come to acupuncture at a low cost.
Yeah, it's been great. And the feedback that we've had has been amazing.
It has, hasn't it?
And that community clinic is only around once a month.
I know.
And we can see from the treatments that we've provided to the women that have been attending that those that are unable to access acupuncture weekly, they can still get some really great therapeutic outcomes from having treatment once a month.
Absolutely.
So it's still possible. Yes, we as practitioners will recommend a treatment plan, but we're also really happy to go with what our individual patient needs. And if you can't make it weekly, there's still opportunity there to get some relief from a monthly treatment, which is amazing.
Yeah, definitely. And that's what we're trying to find in our needle relief study as well.
Yeah.
Does low dose acupuncture provide relief for pelvic pain? Because we know high dose does.
Yeah.
But let's be realistic. If we've got an endo patient who's also seeing their women's health physio, seeing their psychologist, and then their specialist, how can we implement acupuncture in a really practical way that can help to reduce their symptoms and improve their quality of life?
Definitely. And I always say to our patients at the Dow in clinic too that, you know, you coming for your treatment, I'm your PT, I'm giving you a little training session, and it really comes down to what you're doing outside of these sessions that will really make a big impact. So that means taking your supplements and Chinese herbs really consistently if you're open to taking them, and all those lifestyle changes that we talk about.
Eating warm foods, simple as that. If you take one thing away from this podcast, 80% cooked, 20% raw with your food. So now let's get into our did, our does.
Yes.
Okay. So a listener has sent through a question. I'm waiting for a laparoscopy. What can I do?
Come to get some acupuncture. No, honestly, there's so many things you can do. Remembering that, you know, you don't need a laparoscopy for pain management, but if you're at a point where your quality of life is really suffering, then that's completely fine. And you get great results from laparoscopies too. We're definitely not against laparoscopies. It comes in when we really, really need it. But I'd say come in, look into getting in some regular acupuncture sessions. Also, we always refer our endo patients to our lovely women's health pelvic floor physios that we work alongside with, because even being able to notice where your pelvis is really switched on, those muscles are usually very tight for most women, and being able to relax those muscles, they provide a lot of relief for women, which is just fantastic.
And that combination of acupuncture and women's health physiotherapy together.
Oh, dream team.
Dream team. If you're going to try 2 allied health therapists, and you want to be open to something complementary, then that's your combination. Yeah. And if you're interested in finding a women's health physiotherapist who's trained in endometriosis, reach out to us on Instagram because we will be able to help you in the right direction.
Yeah.
Definitely. Yeah. I think as well, just highlighting the importance of supporting your central nervous system and your heart.
Absolutely.
Yeah. So we understand the journey with any health condition, but especially endometriosis, to be very challenging on both our physical but our emotional well-being. So I think if you can do anything in your day is just to think about filling up your cup, whether that's getting some sunshine, going for a walk outside, doing a meditation, you know, taking a magnesium supplement. These things are going to fill up your cup, which is going to support your central nervous system to be in more of that state of rest and digest rather than fight or flight, which unfortunately it is most of the time. So I think those types of practices will also support inflammatory levels in the body.
Because endo is such a whole systems disorder, you've got to look at every aspect. So the mind, the body, the digestion, how are your bowel movements every day? Are they abnormal? Because we know when women have huge flare-ups that usually comes into it as well.
Absolutely.
Supplements are huge. Us at the Dow, we do practitioner grade supplements. So I also just want to make a note, it's really important that you talk to a healthcare provider about your supplements and make sure you're on really good quality ones.
Individualized.
That's individualized for you. And that might be touching base with a Chinese medicine practitioner or maybe a naturopath or even dietitian. Dietitian can work on your diet. Some of them also do supplements as well that can be high quality grade that are really tailored for you as well.
Make sure they're women's health trained.
Women's health trained. Exactly.
I'll finish on my tip, which is track your cycle to get to know your patterns of pain as well. I think if you can understand your patterns of pain, then you are in more control. You know when the pain is predicted, and then you can also manage it with lifestyle factors. So say, for example, if you've got something socially on that you were considering drinking alcohol, which we know is an inflammatory driver in the body and potentially is going to cause more pain, then that's maybe a day where you drive and you don't drink. So, and listening to your body, like Molly was saying, I think is so important. And always be an advocate for your own health. So educate yourself as much as possible and build that multidisciplinary team around you who's there to look after you, and you're in the center there. They're all communicating, because it makes a big difference to how your endometriosis is managed.
Yeah. Yeah, great.
So let's finish with dessert.
Woohoo.
This is the first time on the podcast that we're using this segment. So introducing dessert, we're going to end with dessert, which we will empower you with key steps to taking action and enlighten you with the knowledge of how to move forward to better improve your health. Now, we've really mentioned most of these, but I just want to make a quick note on the DIE scan, so the deep infiltrating endometriosis scan. Now, this is the scan that is needed to be able to diagnose endometriosis via ultrasound. Your standard internal ultrasound is not going to pick up and diagnose endometriosis. There is a reason of why this scan is a lot more expensive, and that's because it has the skill to be able to diagnose endometriosis like a laparoscopy. So a lot of patients will actually be referred by their fertility or gynae or surgeon specialist to be able to then go and have this scan before they have a lap. And the reason being is that can actually confirm where the endometriosis is. Now, I recommend Sydney Endometriosis in Sydney, guided by Professor George Condis. He is incredible wealth of knowledge, and he is leading the way in non-invasive diagnosis of endometriosis. So definitely worthwhile looking into his work.
Yeah, amazing. And on the front of some tips as well, train. If you're a gym junkie, which most women here are, train with your menstrual cycle if you are having a bleed, or train with your pain flare-up. So that just does come down to tracking. Make sure you're really familiar with when that happens, and talk to somebody who can give you some specific exercises on training with your cycle. That would look like really pulling back on the high intensity style of your movements preceding your period or preceding that pain event, because we know that it can cause a lot more inflammation, and a lot of women usually have the onset of pain when they're doing those high intensity HIIT training sessions, circuit work, and things that you can still move your body. We are built to move as humans. So look into doing more lower intensity exercise like walking and swimming, or you can do Pilates. You can still do weights, but just low intensity, low reps, heavy weight style of exercises.
Stretching and yoga.
And yoga.
Beautiful. I think that's important too when we're working with our women's health physio. They'll be able to guide you, and our exercise physiologist, another great allied health practitioner to support you in order to move, because we want you to move, but what suits your body.
Absolutely. And listening to your body.
Yeah, definitely.
Last but not least is, if you'd like to learn more about the history of Chinese medicine and women's health, there's an incredible book. It is fiction, but we all took away a lot from it. It was an incredible read. And that's Lady Tan's Circle of Women by Lisa C.
Yeah. Amazing.
Great one to add to the list.
Definitely.
Beautiful insight into traditional Chinese medicine.
Absolutely.
And the way it was practiced all those thousands of years ago.
Yeah. A few patients have taken that book to book club, and they've had great feedback from their friends as well, which I think is amazing. So
beautiful.
Yeah. Thank you so much for listening to episode 2 of the Delve podcast. If you've enjoyed this episode, please share. We'd love to see where you're listening, and we can't wait to see you in the next episode. Bye.
Bye.
Thank you for listening to this week's episode of Delve and being a part of our community. Follow @TheDow on Instagram to vote in our polls and stay connected. Ask our team a Dear Dow Does question via the link in our show notes. And for more information and to sign up to our newsletter, visit our website.
The content provided on this podcast is for informational and educational purposes only. It's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare professional with any questions you may have regarding a medical condition.
Leaving a review on Delve helps others to find our show and increases awareness for women's health and traditional Chinese medicine. We would love if you can take a moment to like, subscribe, and share. This episode was recorded on Gadigal land. Always was, always will be traditional Aboriginal land.